We have a quorum, and so we're going to move on. Don't expect to have quite as much of a marathon as our last discussion, but it is very important, and it's one of the bigger items in our budget as well. We have Bill Dennehan, who's known to all of us, with the Adams Board. And Bill, I know you have a presentation for us, and then we'll go to questions, and we're looking forward to your presentation.
Thank you, Chairman Brady, and to council members. Thank you for allowing me to be here today. Before I begin, permit me to introduce and recognize our board chair, Charlotte Still-Noble, right here, and our board member, Eugenia Cash, is holding the other end of the room down right there. And I have 6 executives, Cassandra Richardson, Valeria Harper, Scott Osicki, Tammy Fisher, and Delis Reyes, Dr. Delis Reyes right here, and John Garrity. So if I say something wrong or misstep, I'm going to be calling them up real quick. They're outstanding professionals, and I want to make sure that they got recognized. So to begin with, first I want to thank the county executive for holding us harmless from the last budget on this budget, and because that actually will be the first time in a number of years that's happened, and we want to make sure that the county exec knows that, and we're appreciative of it. But in spite of that, I'm coming in front of you asking for $25 million more than what has been recommended. And that requires just a brief moment about background. We know the economy has played a significant role in it. We know that the dramatic decreases on the state level has also played havoc with us. And at the same time, to complete the perfect storm, the elevation of Medicaid to Columbus has done it. And the other part that is significant, we feel, is the inability of the county over a long period of time to keep pace on funding with the growing demands of behavioral health that we've seen. All those brought us to this past year where we had a significant reduction in funding for our local funders. We cut them just a little less than $10 million, and doing so, we eliminated funding for individuals that need it the most, those that are uninsured, that we call the working poor in our community. To make those decisions in our RFI proposal, we notified each one of our providers that there was no guarantee of funding, that they all have to make proposals for their services, and that has to have cost ramification and performance outcomes that were part of the proposal. The RFI also stretched we required the RFP to be services only. We were looking at the administrative cost. Over the years, we reduced it from 18% to 15% to 12%, and this past year to 10% of the cost that we would pay. The overall result is that on the mental health side, 22% funding cut on all the mental health providers as a general whole, and 21.5% reduction on the alcohol and drug side. We did prioritize children, schools, crisis, housing, employment, and emergency services. They got cuts, but lesser cuts. As a result of our approximately 60 providers, we eliminated and had no funding for 8 providers, and 6 providers we strongly encouraged that they were going to be around next year for them to merge or consolidate to help reduce the funding consequence. In spite of all that, we are seeing our intakes not open or close. We see longer periods of time to do assessment and longer period of times to do treatment, and less treatments over the time. During this time, to deal more efficiently with things, we made policy changes, and one example is our detoxification policy. We found that on detoxification for individuals that we had a very long waiting list. And we realized that there was a certain number of individuals that were coming in for a second detoxification treatment within a 12-month period. And we took analysis of that and said, and came out with that unless there's a medical reason, or unless the woman is pregnant or they're withdrawing from alcohol, they wouldn't get a second treatment, and that we would make it ensured that the person that has never received treatment would get the first treatment if that was the case. As it turns out, we eliminated our waiting period, and it has served its need by serving more people and being cost effective at the same time. Our board and administrative costs were also significantly reduced. We sliced off 1.3 million of our salaries, which is 18% of the administrative costs, by eliminating 18 positions, which resulted in 13 staff layoffs. So out of our $154 million budget, we have an administrative cost of $5.6 million, which is 4% of our total budget. So we did that actually first before we had any cuts on our providers. The impacts of the cost reductions, we asked all providers to respond back to us some of the impacts. Personally, and I could tell you, of the 1/3 that responded, and we're still getting responses today, there is 77.5 staff layoffs, which included ours. Intakes or clients have been closed, and waiting lists to get an assessment, to get treatment, if they get assessment and treatment in the first place, is taking much, much longer. The cost to the community we see increasing in courts, in jails, in prisons, and in emergency rooms for untreated people. In terms of our justification for our funding, we had a needs assessment completed earlier this year, completed by Center for Community Solution. And they estimated that 27,512 residents who have moderate or severe mental illness and 19,775 residents who have alcohol and other drug addictions were identified as not being served. After factoring out the residents who would qualify for Medicaid, the increase of $15,770,000 is needed to help provide mental health services for 5,310 people who would not be covered. In terms of alcohol and drug, it's 1,179 people that would not be treated. So in order to restore the existing populations, we asked for an additional $9,700,000 for a total of $25,470,000. I want to go over that again. The $9.7 million will replace the services, almost all the services that we cut this last 3 months. The other part of that $15.7 million is the inability that's happened over the years to keep current or pace with the demands of mental health and alcohol drug in the community, and that is the part of the unserved individuals that we're not serving in our community today. On top of that, we have other areas in which we're being challenged. Opioid addiction is taking an extremely huge role in the state of Ohio, especially in the southern part of the state. But here's a couple things that are really distressing. 50% of adults on Medicaid were prescribed opiates, with 10% at a level that indicates addiction, and it costs 8 times more to serve that same 10% because of doctor visits and the trips to emergency rooms for physical symptoms. Cuyahoga County is not exempt from all this. We have learned that there were enough prescriptions filled for painkillers to provide 67 prescriptions for every resident in Cuyahoga County. That means all of us in here, and all of our family, and all of our children, and all of our residents, there is enough prescriptions filled that each one of us would average 67. In some of the other counties, it's in the hundreds. And 4 people die each day because of opiate overdose. Is one of the leading killers in our community. Over the years, the leading killers in our communities traditionally was automobile accidents. Then next was suicide. Then next was homicide. Then next was a plethora of other things. Opiates was in that. For the last 18 months, opiate deaths from overuse of prescription opiates jumped to #1 in the state of Ohio. That is especially troubling since that is the #1 killer, that to get the straight funding is extremely challenging at this point in time. Additionally, another challenge that is special for our county is addressing House Bill 86, which is embracing the Justice Reinvestment and Sentencing Reform Act. It provides reduction in prison costs by diverting nonviolent 4th or 5th degree felony offenders to alternative facilities, such as halfway houses, the community-based correction facilities, where treatment and community reentry services were provided. We're working with the community reentry services to make residents available for this, but without funding, this doesn't work. Currently, Cuyahoga County has 5,000 ex-offenders returning to our community. Presently, we have 4 programs that serves less than 450 individuals, which is about 8% of the patrollees returning to Cuyahoga County with our 4 reentry programs. Programs have been extremely successful in reducing the recidivism from 65 to just 4%. Returning Home in Ohio, which is the mental health services program, has lowered the recidivism rates from 50% to 4%. Patrol Assertive Community Treatment at Recovery Resources has reduced recidivism from 65 to 25%. And Correctional Advocacy and Reentry Support CARES out of Murtis Taylor reduces it from 50% to 9%. It's clearly the overall goal is to reduce the recidivism, reduce crime, and at the same time create jobs. It costs us about $3,234 a year to provide a range of successful outpatient behavioral services of ex-offenders, as compared to $35,000 a year in the state. 1/4 of all the prisoners are from our county, so it is also additional challenge. It could be an opportunity, but it's turning out to be a burden without adequate funding. The other thing that I want to mention why it's extremely important, I believe, in terms of funding, is that the life expectancy of someone that we treat right now today is 53. Our life expectancy is the 80s. That's not me. That's a statistic from the Center for Disease Control. I believe we could do better. I ask for your consideration to set an appropriate funding level and a long-scale vision to support behavioral health and the needs of the uninsured in our community. Thank you very much for allowing me to come in front of you.
Thank you, Mr. Denahan. You had indicated that of the amount that you're asking us to consider, that 9-point-something was to restore programs that you had to cut this year, I assume, due to cuts from the state government. And
That's correct, Chairman Brady. Of the recent cuts was just not the state, but ongoing deficit that we have. We reduced our funding a little under $10 million. So,
well, could you briefly then remind the committee that why you had to reduce your funding by $10 million, include the state cuts, include whatever else is involved?
well, it's all this did not happen overnight. We continuously used any carryover dollars or reserve funds, and we ran out of that. We used it the previous biennium, previous years, and so we had no more in the pot to pull out, and we usually had some in the reserve funds to pull out. We didn't have that anymore. Plus, the state cuts was, in our viewpoint, extreme, and plus we had another cut from the county the year before. So all that adds up, and it added up to the perfect storm of our original thought, Mr. Chairman, was we were looking at either $19 or $20 million cut, but we got it down to just less than 10, which resulted in a number of deficits that I've just explained to you. We kept our priorities within the system. They got lesser cuts, but it still is having grave ramifications in that intakes are closing, which means folks are not being assessed in the first place. And if that is starting to occur, then the emergency rooms start to build up. And if they don't go there, they go to the largest mental health hospital in the state, which is our prison system. They eventually get there. And the life expectancy of 53, many of them die before they get any of our services. So this didn't happen gradually. We went with the big hit of $9 million happened this past year, and it had the combination of a whole number of things. Admittedly, I believe the state was the larger, had the largest part in that reduction. When we realized that on the state level, over the last 7 or 8 years, they reduced mental health by 71%, and alcohol and drug addiction by 51%. That is significant. And as I said, on the local level, the county's inability to keep pace with our growing need in behavioral health is caught up to us, I believe. 4 years ago, we were at 37 million, and we felt at that particular time we were still grossly underfunded by the county. So all these things, Mr. Chairman, added up to what we have today.
So, Mr. Dinahan, you've received up until this year, you received less funding from the county each year, going back for how many years?
Well, actually, back to 2008, Mr. Chairman.
All right, so for the last 3-4 years.
Yes.
And you've received less funding from the state going back about the same amount of time?
Well, state goes up and down, but the more significant cuts was in this past year, and the elevation of Medicaid, which changed how we get our community dollars. It's distressing to know that in the community line, which they now call 505, which is about $34 million for a community to do those things I just talked about, we got $235,000. We have 11% of the population and about 15 to 18% of those individuals that have serious mental illness. And just getting 10% of that 33 million would have been about 3.3 million. So the state has found different ways to use formulas that are not, in my viewpoint, sensitive to large urban areas, and we're facing that at the same time. As it turns out, we will be attending formula meetings in Columbus to straighten it out for the larger counties to receive more funding, hopefully in the future. That's where we're at, and that's why we've asked for the funding increase.
Thank you. Questions by the committee?
I have a question on your point.
Councilman Conwell, Councilman Conwell.
Mr. Chair, to the director, I understand you're in a difficult position. If some of the additional funding requested today is provided to you, if some, how do you go about determining who would benefit from the additional?
Mr. Chairman, to Councilman Conwell, I would have to look at our priorities, and our priorities, children, schools, crisis services.
I guess, Director, I was looking at more of the priority. I know you would say priorities, but when we talk about priorities, I guess I want to know which funding. Would it be mental health? How would you prioritize mental health, alcohol, and drug?
I wouldn't make it that much of a distinction between the two, because as it turns out, the total cut of both of them, one was 22% and the other one was 21.5%. And I wouldn't, the other part is, I'd have to be careful about this statement, mental health funding is usually 2 to 3 times more than alcohol and drug. So on a prorational basis, I would look at that. And the other part is that on the alcohol and drug side from the state, we're in a crisis because of the extreme funding cuts that is happening on the state. We might have to give that more consideration. Otherwise, we may not get any funding at all. So I think my consideration would be, number one, look at our priorities. And we had set our priorities, and I'll remind myself, is school, children, crisis, housing, education. Those are our priorities, and crisis services. So within that, we look at the initial cut that we had this past July and see where we could spread the dollars around where it has the greatest impact. And it depends how much money we get. We cut over $9 million. And so we would have to look at those institutions that will get a greater impact in response to the crisis that we're in today.
I was just wondering, Mr. Chair, is it okay to possibly ask Mr. Dinahan to bring some of those, to send us these priorities while we're making these heavy decisions?
Yeah, if you don't mind, I think I know where you're going. The council is approached by everyone in terms of the budget process. Specifically, we are being approached by entities that are telling us that they lost funding from the Adams Board. And so the chairman of the Finance Committee has requested that we bring forward our recommendations, initial recommendations, but time's moving along here, on Wednesday. I think, not speaking for the councilwoman, but I think if it's possible to provide the council with some list of where you might spend, what your priorities would be if you had a higher level of funding, is what we would be some of us would be interested in taking a look at. Again, this whole process is different than any time before for everybody. It's all out in the open and naked. So this is the only way to go about this. Am I close enough?
Chairman Brady, to Councilman Conwell, I believe we could come up with something the caveat would be, it'd be by the dollars. If it's X dollars, I will look at that with my executive team and determine what expenditures we would make. I think that's a fair question.
Councilwoman Conwell.
Director, through the chair, if you could, this is a wish list now. If you can set it up from maybe a 5 million standard, a 10 million standard, and a 15 million cap.
I could do that to the council chair and to Councilwoman Conwell. We could do that at 5, 10, and 15. We could even do it at 20 and 25 if you wish. So I'm glad you still have a sense of humor.
Well, so far.
Not just, I just want to follow up with another question, and it may not come out directly as a question because I think you answered it through the chair to the director. I believe you testified that the intakes, some of the agencies are beginning to close their intakes. So I guess I'm really concerned about this. So how can the agencies continue open intakes, you know, if the funding has been cut?
That's a very good question to the chair, to Councilwoman Conwell. The essence is, if they take an uninsured person and they're moderately or severely ill, they're not going to treat them for 1 day or 1 week or 1 month. They may have them for a year's time. So that they don't want to have the intakes open and find out in April or May they have no more money to fund all the people that they have. So they are looking at the total population that they have and realizing that the dollars they have fits that total population, and they don't want to go over that population and not be able to give them the proper services. And my sense is they're already doing that by not accepting the intake, but also holding off on a second or third treatment within a time period. They're reducing the number of treatments. They're holding off on the assessments, and the intakes are starting to close. When you cut off 1/5 of a funding of something, it's going to have grave ramifications, and I unfortunately believe that's part of the ramifications, that some of these things are just not 1 day, 1 week treatment. They're an entire year, and they cost X amount of dollars. And so they're evaluating what their population is by their programs. In fact, we have started what we call a SCALE program, which is screening, centralized assessment, and level of care. This is a central intake process and a collaboration with our adult providers to increase the access for the newly uninsured and to have some cost containment and some consistency of care. But we're finding even in that program, through the loss of funding, that the end result is they are learning how much it costs to treat somebody that's mild, moderate, or severe on an annual basis, and multiplying the population of that to see if they could last through the end of the year with the population that they have today. And that's why they're closing. The only good news is, if there is good news, is it's November 7th today, and the more we're into the year, the closer we're getting to that cutoff point where they'll reach that population as it relates to their funding.
Mr. Denahan, are you saying, and if you are, I don't know if you are, is the cuts that you've experienced are unfair or unjust? And if so, explain.
I'm sorry, Mr. Chair and Councilman Gallagher, I didn't understand the question.
You keep going to the cuts that you've experienced. Are those unfair or unjust? Are they arbitrary, or are they based in fact?
Well, Mr. Chair, and to Councilman Gallagher, they are based in fact. It's my opinion that they're unjust and unfair. It's my opinion because I see the ramifications every day. I could tell you that the cuts are factual. I didn't make them up, and I didn't dream them, and I'm living them. So I could state here and state qualified that they are true, and that there comes a time when you're in a position like this, you have to, I believe, speak out the truth and the ramification of these cuts. And these cuts are a disaster for this community.
Explain, please. Explain, please, why they're unfair.
Mr. Chairman, to Mr. Gallagher, the people that are ill and sick are ours. They're our family, they're our friends. Everybody that we know can be exposed to mental illness and alcohol and drug. And I believe that they're unfair because by treatment early, we could save a lot of grief and heartache and save money at the same time. I think it's unfair to be cost foolish and just spend money on the deep end. Pretend we have a ruler. People are mild, moderate, and severe. Now, if we take the money and put some in the moderate, we're gonna slow them down and probably stop them from going to severe. But if we take the position in our community, we're just gonna treat everybody that are severe because we have to, that ruler goes down like this. Those that are mild and moderate come down to severe, and we're spending more money than we should. So if we're going to be cost effective, we got to have a program that recognizes people that are moderately ill, and that we could prevent them from being severely ill and save the state a lot of money. And in terms of fairness, I think that we're the safety net. One of our obligations for the state and the highways by code is we are the safety net for those individuals who do not have insurance to provide them treatment and recovery. That's the role that the state plays for us, and I don't question whether it's fair. I question whether we could do it. And my belief is that we are limited and we're not doing a very good job right now.
Why wasn't this plan implemented 20 years ago? Because
well, 20 years ago,
it seems what you're, and maybe I'm wrong. Tell me if I'm wrong, if I'm hearing this wrong, because I'm trying to understand it. You're saying that had you not been cut, you would have implemented some sort of new plan, and that everything would have been better. And my question is, well, where were we 20 years ago, 10 years ago, 5 years ago?
Mr. Chairman, Councilman Gallagher, that's actually a great question. 20 years ago, a guy by the name of Ishiami had my job. And he came to the county commissioners in 1989 and said the same things I just said to you. And he said he wanted a levy. The same thing I said to you 6 months ago. He didn't get a levy. He got a check for $10 million. His budget was $3 million. He got a check for $10 million. So for the next 5 to 8 years, they did pretty well. But they did not want to give him a levy, and the level of funding, why it was good for a few years, kept on going down. Why the need was at that level okay. It just kept on rising and rising and rising. And I don't want to blame people in the past. I just want to share with you that there was an inability to keep up with the demand and rise for mental health treatment. And it's not just significant for Cuyahoga County. This is a national issue. It's not and a state issue. And I think that somewhere along the line, we have to figure out what programs work and where we get the greatest return. And I believe that we've turned that corner, and we do know what programs work and get the greatest return, where they are cost efficient, they have outcomes and performance measures, and they do make a difference. Let's take reentry. If you were the Chamber of Commerce and you wanted me to come to speak to you, I would say this: how would you like a program that reduces funding for state government? You might think that's great. Then I say to you, well, how would you like a program that reduces crime? You say, oh, I got your attention. How would you like a program that creates jobs? I really have your attention. That is reentry in this state right now, today. And right now, we're ignoring it. We're paying $25,000 to $35,000 a year for individuals that are first-time, nonviolent offenders using dope for the first time, not distributors, that are treated as felons. Costs us $30,000 to $35,000 a year. We could take care of that person and bring him back and make him a productive member of the community an extraordinary amount of time for about $3,300 a year. That's really good. And I think that's an asset for us. And it's an extraordinary opportunity for us in Cuyahoga County. Getting 1/4, incidentally, we send 20% of everybody going to Columbus and prison. Somehow we get 27% back. They grow. But we get 27%. We get more than 1/5 or 1/4 of all the prisoners for all 88 counties. And it's an extraordinary handicap, and they get into the same old neighborhoods, they get into the same old gangs. And if they're the first-time offender and they have no relationship to us, then they become a second-time offender and a career criminal. So I think it's an opportunity, and I think that we're missing that opportunity. And by appropriate funding, we can make a difference in our community.
Last question, Mr. Chairman. And believe me when I tell you, I understand the predicament you find yourself in. But we have sat here for many hours, and that predicament is throughout the county and all the services that are provided. We happen to be sitting in, if not the number 1, number 2 poorest city in America. We're in a county that's considered a poor area. We have well over 10% unemployment. Who are fighting for those jobs, for those reentries? Who do you think are going to get hired first, the reentry or the 10+% unemployed? We have cuts to cities, we have cuts to states, we have federal cuts, we have reduction of workforce here in the county. We have unknown costs with the health care coming in 2014. Our county workers, those that provide these services, haven't, for the most part, been given a raise in 6 years. So our struggle is to look at a request of, say, $25 million or a $5 or $10 or $15 million hit, where, how do we do this? Where does this money come from? Because the very people that provide that money aren't working or are working and getting less. So that's our struggle, so you know kind of where we're coming from. It's not that I don't appreciate what you have to deal with, but we've heard this time and time again from all divisions within the county, and they all have great justifications. So I just want to let you know that the struggle is equally shared throughout. And I really don't envy your position, and I appreciate the work that you've done. Thank you.
Councilman Greenspan.
Thank you, Mr. Chair. When I tell people about the job you do, you're a phenomenal advocate for your agency. And I appreciate and echo Mr. Gallagher's comments. The issue, and he touched on it, but the issue to make it more concrete that we're facing in dealing with this budget is the budget itself is not balanced, especially on the Health and Human Service side. We're dipping into $12 million over the 2 years and $22 million over 3 as we're going out. And we'll talk about this for a discussion at a later time, but we haven't even evaluated and determined what our appropriate reserve balances are going to be to even determine if we have any money available for whether it's a $25 million request or a $50,000 laser copier copier that we'd heard of earlier. So what not to be repetitive what Mr. Gallagher said, but to dovetail on what Comwell said, when you put together this list that you're going to put together, if you could prioritize it almost by program, and if there's any funding available that'll be a determination we would make. But I think we're, as a body, pretty far away from us being able to tell anybody if anyone's going to get anything. And I think it's hard to justify any increase in spending until we determine what our appropriate reserve balances are as a minimum criteria, and then how to replenish those if we dip into it. And then furthermore, if there is an excess this year, how we can consciously appropriate it and maintain sustainability in the out years when we don't know what's going to be happening with the economy. So that's just kind of additional dovetail into what Mr. Gallagher had to say. But just keep up the work you're doing with the resources you have, and we'll try to help you and the other agencies as best we can when appropriate.
Mr. Chair, can I respond to both?
Go ahead.
You've already given me something. You've given me a chance to speak out and listen. I don't expect everybody to agree with everything I say, but I think the ability to express oneself and be taken seriously is tremendous. I appreciate that. You're right, I don't wear your shoes, and I have great respect for each of you going through what you're going through. This is not easy. And if you need any advice about the reserve, I can help you there. Don't lose your sense of humor now. So this has been, from my viewpoint, it's been refreshing. And you guys didn't start the fire. Remember that. I don't believe you did. You have a chance to help put it out and do something with it. And the other part in my comments is I'm looking for a long-term plan that gets us to sufficiency in terms of adequate funding for behavioral health. It may take some time to do that. But I think that with open discussion and opportunities as they come, that we could get there. I really do believe that. And I appreciate the ability to come in front of you and share what I believe is the circumstances and the status of where behavioral health is in the community. And I appreciate you all listening to me.
Yes, just hold on just a second. Just so I don't forget. I think that you're at a disadvantage in a lot of ways compared to other requests being made and the proposed budget. But I think one of the things that you have going for you is that because of your willingness to be aggressive and open with this council, you have some autonomy that is fortunate, but it's also part of your personal nature, it appears. So the more information that we can have, which would be true across the board in the county, but in your case, we may be able to get it. The more specific information we can have, I think the better judgment we have a chance to make. I want to at some point move into a fairly brief discussion at this point. But you had mentioned about what you're looking for is a long plan. That's what I'm looking for too, is a long plan. Obviously, your request, the request is the limitations the county has makes it difficult to meet your request. And I would encourage any advice you may have about the county's so-called reserve, or how anybody wants to necessarily interpret what our financial health is. To be able to help us better understand what resources are available if you think we don't, or even if you want to just help us understand it better. Because you did come, we did have discussions earlier in the year, I know I did, and I'm sure others did too, about a separate levy and whether that might be desirable or not. It's the case in some other parts of the state. It's certainly, undoubtedly would provide more resources for you. Lots of other questions are involved. A lot of people wonder whether we can handle 2 levies. Some think we can, some think we can't. But it may be, we may not have, we may not have a choice about that if we don't have another way to go. What we can do this year, I'm not sure, but what we do in the future is, I think there's the potential, if we have the will, to do something differently than has been done in the past. And so I'm open to consideration for, 2 levies, if I can be convinced that it's viable and one doesn't, sink the other. But I think it's worthy discussion, and it may be one of the only ways we could ever possibly get anywhere near where you want to get, not to mention all the other policy implications that would go beyond just the level of what a separate levy would bring in.
Mr. Chairman, thank you for that thoughtful overview. I would really love to entertain the levy process, but I understand the economics and candidly the politics of that today, and I think that all those have to be taken into consideration. And I would like to have this moment to share what I believe we need, and hope that we get some semblance to address that need with a discussion for a long-range plan. And if a levy turns out that way, then so be it. If it doesn't, then perhaps an ability to get more out of the current levy is the answer to that. So thank you.
Miller.
Mr. Chairman, Director, first I want to share with everybody that in one sense it's even worse than you stated, because I was in the legislature when the fiscal year 10-11 budget was passed. That was the last one that I saw as a legislator, and that was a very bad budget for mental health, and so it's not just the most recent one. It was the 2 last consecutive biennial state budgets have been involve very serious cutbacks. So I think that well, I would just ask one question, which is that I know the legislature passed a very mild form of mental health parity a number of years back, and my question is how much room for additional progress do we have if we could get insurance coverage for mental health to truly be similar to that for physical illness? Could that be part of the long-term solution, or have we obtained as much as we're going to obtain in that area?
Mr. Chairman, to Councilman Miller, 4 or 5 years when we passed it through yourself and Senator Spada, I really thought that the parity for mental health was the big answer. I haven't seen it that much, because if it's not, the growth of America and businesses, small businesses, and it eliminates small businesses. And I'm not suggesting that we should go back and include small businesses, but it's not working out to the degree that I thought the impact would be. And with the absence of non-parity for alcohol and drug abuse, it makes it that much more difficult. And I would love to see it stronger and greater, but I think there has to be, it gets back to Mr. Gallagher's question. Why do we want to spend any amount of time discussing this and funding behavioral health in our community? And the implications that has. I think that's a legitimate question on the stage today. And when county and city and state councils and legislatures are all meeting about the same thing, I think that the answer is not easy. And what I know is I know what works. And I know what works and to benefit the community. And I think that threshold we've crossed. With a certain amount of dollars, we could deliver something. We couldn't say that 10 years ago, but we could say it today. With a certain amount of dollars for a certain clientele, we could deliver A, B, and C. And we are becoming more accountable that way. We talk in terms of economics today. And we're going to have to continue to talk in terms of economics of what benefit does this yield for the community after you put the dollars in and those persons are served, what benefit does that have? And I think that model is going to play out more than any other model. If we can't prove that we make a difference for the dollars that are allocated to us, then they'll be allocated elsewhere.
Mr. Chairman. I would just close by saying that that I certainly don't see where an increase of $25 million a year is immediately available. But I would also say that that you have made a very strong case that a serious problem exists that we're going to have to deal with in time. If it takes people months to even get an assessment and additional months to get treatment, that's not a formula for a healthy community. And I also do think that that our capabilities for oversight have improved. I think that that there is a greater capability now than there was maybe 20 or 25 years ago to monitor expenditures, measure results, and ensure that investments are actually producing the returns that are intended. So I think we're all going to have to take it seriously, and if we're going to have to determine how much, if any more, we can do immediately as part of this budget, but we're also going to have to take it as a challenge for the good of this community going forward to find some kind of a solution. Thank you, Mr. Chairman.
Any other questions by committee? Hearing none. Thank you, Mr. Denahan, for your time today. If you've got any further comments to the committee, feel free.
Mr. Chairman, thank you for the opportunity, and I'll be back Wednesday with the figures, or before Wednesday.
Well, the poll's open at 6:30 in the morning, but no, just kidding. Sooner the better.
Thank you very much, Mr. Chairman. To me, members, thank you for your attention and your questions.
Okay, all righty. I'm going to move on now to the Cuyahoga County Board of Development Cuyahoga County Board of Developmental Disabilities, and Terrence Ryan. welcome. And we're
Mr. Chairman, welcome for
forward
the
to your
second time today.
presentation. We're Get our third wind here.
Right. Members of council, I appreciate the opportunity to be here. And of course, we are somewhat different than our counterparts that have come before you today, and that what I'm bringing to you today actually is an executive budget summary that has been approved by our board, statutorily approved by our board on October 27th. So our board has approved our budget for this year, and again, we're bringing this document to you for your oversight. It's the first for us to be in this particular situation. Not that we hadn't had the opportunity to be before commissioners before, or the county administrator. We had on various years, the county administrator or the Cuyahoga County Commission. I have brought some of my distinguished staff leaders with me. You'll meet today Kelly Petty, my Chief Operating Officer, David Wysocki, my Chief Financial Officer, and also in the audience is my Chief Clinical Director, Dr. Cirillo, and my Chief Budget Analyst, Lee Collini, who works a great deal with the County Executive's Office and the budget people here today. If the technology allows, when Mr. Nani had requested that we appear, he said we'd have about 20 minutes or so. And again, we'll try to stick to that format and answer any questions that you might have. But we do have a 5-minute video. If technology allows it, we'd like to play that 5-minute video, which is sort of a little bit about the board in our past year. And then we'll move forward with some of our goals and objectives for 212, the budget for 212 and 213, and then I will finish with what we call Shared Commitment 2015, which will bring you up to speed with where we are in year 7 of a 10-year plan. We've always taken a long view. 10 years is a long time to forecast out. When we passed our levy in 2005, I made a commitment that we would take that 5-year issue and stretch it out through at least 2015. And I'm pleased to be able to say we will do that. And I also expect to be able to take that levy even further into the future with the due diligence that our board, that the management team, the executive leadership team, and our staff and our great community support. So let me start with the video, and then I'll be back. Thank you.
A lot can happen in a year. And it did. More than money management or goals met. It happened in the lives we helped to enrich, in the accomplishments achieved. It was in new skills learned and new levels of independence gained, and in the right to belong and take pride together. Together, we made some great beginnings. Good morning, good morning, good morning. Together, we celebrated some happy endings. And together, we gave students a way to take a step into productive adulthood and be a part of a team.
All these kids are still in high school, so this is just an opportunity for them to come to a work setting.
Well, my favorite part is having my friends and working together, getting paychecks.
We just really want to make them more independent, give them more confidence.
I would like to go to work like at a grocery store, see if there's opening for a grocery store. And I would like to stock shelves or bag.
Together, we planted seeds that allowed consumers to learn and earn. They got to get their hands dirty. And some other parts too. Day after day, we watch the entrepreneurial spirit take root and bear fruit. We encourage job initiative and follow-through. We fostered patterns of self-reliance and ownership. Thanks to unique initiatives and strong relationships, we created far more than jobs. We created a national role model of ingenuity and success.
One part of our store is a training facility in the retail environment, and we've had people go on to like Kmart, Annie Ann's, Panini's. They come here, learn in a retail environment, and they move on to other stores. This is our first store on the west side. We've been open 3 years. We're under construction for the Just a Buck 2 store on the east side, and hopefully we'll go forward with the Just a Buck 3 somewhere throughout Cuyahoga County. We have had many agencies like ours, as far away as Los Angeles, that have come to look at our store and see how we operate so they can go back and within their agency do the same thing with like a Just a Buck.
Together, we worked from multiple perspectives to enrich and enhance our consumers' quality of life. We brought new techniques and equipment into the struggle for mobility that so many must face daily.
Hello.
Goal of the MOVE program is to increase individuals' independence via movement. Here at Brooklyn, we were one of the first sites to start using MOVE with adults in the country. Individuals that have not walked in years are now walking with minimal assistance from staff or no assistance at all other than a pacer or gait trainer.
We also reconfigured our way of looking at group living arrangements, shifting our vision to be more attuned to an aging consumer population. And we invested in capital improvements. Everything from improving our energy efficiencies to expanding environments for better access and easier usage.
What we had out here prior to our construction is we had a cement area with a picnic table and a grass area, a very underutilized area where the consumers are not getting a lot of benefit. What we will be having, once completed, is we're going to have a rubberized area for mobility purposes. We're going to have an area with paver rock for aesthetic purposes. Also, we are going to have various flower gardens and plants, which will serve many purposes for the consumers. They'll have a much more fulfilling day. And this will encompass all our consumers, where prior to, it was very underutilized and only a few people would be able to benefit from it.
In many ways, the year was extraordinary. But when we look to the future, we can see that everything that happened is all a part of what we can achieve together.
I often say the people we serve are worth 1,000 words. They tell the story, and many of the council members here, all of you, I think, are familiar with our work. And recently, many of you have come out and spent some time with us, and we certainly appreciate that very, very much. You are very, very important to the people that we serve in this community. We have many goals and objectives going forward to next year, and we just want to share some of those with you. I'd also like to let you know, too, that I know the county is working with County Stat, and we've taken County Stat and we've developed, or in the process of developing what's known as DD Stat. So we'll, statistically measure all the things that are necessary for us to measure to keep us on track. So Kelly Petty, who has been with us for 20 years, I can't believe that, but Kelly is the assistant superintendent, and within the last month was promoted to my chief operating officer. So Kelly will talk about our goals and objectives. Thank you.
Thank you. Good afternoon. As Dr. Ryan said, we have many goals and objectives for 2012 that we're very proud of and looking forward to accomplishing. But in the interest of time, I'm going to highlight really just a few. The first, also, you have before you the executive summary. You also have a copy of our complete program and expenditures plan for 2012. That lists out all of our goals and objectives. in detail if you're interested in looking at that later. But just a few of our goals for 2012 in the program areas. First of all, services for adults. As you saw in the video, many or most adults that are served by the Board of Developmental Disabilities either participate in an activity center during the day or a sheltered work setting during the day, or they participate in some type of supported community employment. So you saw people working at a hotel, working at a retail store, and some of the what you saw in the video were people working in our centers. And so part of our goal every year is to continue to look for ways to improve those work opportunities and opportunities for people to participate in productive activities during the day. We know it's very important for individuals in our program to do that, because if they don't have something meaningful and productive to do during the day, we often end up having to pay for it, if you will, in another way, possibly have to increase their residential supports. They may exhibit behavioral issues that have to be managed, and those cost us in other ways. So it's very important that they have those activities or work opportunities to do. And also, to the extent that people with disabilities can increase the amount of income that they receive, then they're less reliant on us to help them with certain things like cost to live subsidies or other expenses. So that's a big part of our goal. And also, related to both of these things, we also, what we showed you in the video mainly was board operated programs, but we also work with a large number of private Medicaid certified providers. And almost all of these adults are enrolled in a Medicaid waiver program that pays for the support that they need to participate. And therefore they do have free choice of provider. There's a number of private providers, more and more are developing, who provide many of the same kinds of day services that the board provides. And so part of what we're planning to do in 2012 is a planful approach to see if we can increase the number of consumers who access their services through those private providers instead of using our services, which tend to be a little bit more expensive. Related to children, I just want to focus on the fact, similarly, we over many years have been involved in a transition plan for students to receive their school education through their home school district rather than attending a board operated program. And so we are going to continue with that transition in 2012 through the end of the 2012 school year. Related to community and Medicaid services, those are services that tend to deal with residential services. And again, we utilize Medicaid waiver, the two different Medicaid waivers to pay for residential services. And the IO waiver stands for Individual Options Waiver. In 2012, we plan to enroll about 50 additional people on that waiver. Historically, we would have used all county funds, all levy funds to pay for those residential services, which can be very expensive. And starting in the early 2000s, we began aggressively enrolling people on these waiver options so that we could utilize that funding instead, and it's been very successful for us. So in 2012, we plan to enroll about 50 more people and about 250 people on what's known as the Level 1 waiver, which is a lower cost Medicaid waiver that tends to just pay for day services such as I've been talking about. So that's another goal area of ours. In the MUI area, MUI stands for Major Unusual Incident. Our board is charged with investigating all allegations of abuse and neglect from among individuals that are served by our board. Abuse, neglect, misappropriation, or anything else that's considered major. And in 2012, the Ohio Administrative Code rule that governs that process is up for review. So it's a chance for us to look at, to be at the table to talk about possibly making some revisions and gain some efficiencies in that area. Regarding behavioral and health supports, again, this has to do with our utilizing private providers to deliver supports to people. a lot of our folks have many complex behavioral needs, and they also are, therefore have to have a behavior plan. There are state rules that govern how those plans need to be implemented. And we have a group of staff who are well positioned to provide training and technical support to both our own staff and to external providers to make sure that those plans are implemented safely and effectively. And then finally, we also do a great deal of transportation to our various center-based programs and other programs throughout the county. And so we are continuing, again, to look at possibly the use of additional transportation options for people that can access other alternatives rather than using board-funded transportation. And just to wrap up and turn it over to Dave Vasaki, but the reason why I chose these goals, many of these are focused on are finding some cost savings and efficiencies, and that'll become a little more apparent in the rest of the presentation.
I hope I hit these keys just as well as she did there. Let's do this. Good morning or afternoon, I'm sorry. We've been here a while, haven't we? I get to share with you the financial side of our budget and the world we live in. And Terry said it earlier, and I want to just reemphasize a couple points. One, we really do take about a 10-year perspective on the dollars we have. The population we have is incredibly special. And the last thing that population needs is a lot of change at any one time. So you're going to see a budget that begins to tell you where we are today, but most importantly, I think where the future is going. We knew 2 years ago that things were getting very tight. We knew at the state level there was probably going to be some major cuts. And so we've had 2 years to kind of plan for this. And the kind of numbers I think we're sharing with you today, and really the last part of what Terry's going to talk about, our shared commitment for 2015, is to get to a truly balanced budget by 2015 or starting in 2015. The reason we don't want to take it right now is just because, again, the highs and lows of the people we serve. We think it's absolutely critical to continue to work down. But one of the messages I think that we realize, and one we're sharing to everyone, is we as a county board probably have to get smaller. We probably won't be able to be that $200 million service provider in the future. We're going to have to work with our partners. We're going to have to work in a way that it makes the best sense for the people served, and yet at the same time get smaller as the dollars become smaller, because it's just the reality as we look at it. For the last 10 years, we've been in the waiver business. So when you heard the waiver information today, we very much nod and go, yes, it's a way to draw down federal dollars. It is not an easy process. We probably have about 4,000 people that receive some kind of residential supports, and a vast majority of those receive waiver supports. And at the same time, it's a tremendous amount of work, but it does allow us to refinance it. In our case, it allowed us to refinance our day services, which is a major piece of our business. So the next slide is about revenues. And by the way, revenues are as important to us as expense. As any good business, I think it's critical that you're trying to find every possible dollar. I'm not preaching to the choir. I'm just saying what we believe every day and how we share it with our staff. So every director knows their impact on revenues. They know the things that they can do, and they're always looking to find another way to bill. Our PTs, OTs, speech people have for a long time been simply a cost side of our business. Today, those folks are billing for those same services to the same way that any Metro would bill or Cleveland Clinic would bill or anybody else. You gotta try to find, and again, I'm not preaching to you, but it's just the passion we have on the revenue side is equally as important as on the expense side. When you look at this first grid, this pie, one of the things that should strike you is there are two dominant sources of funding to the county board. The first is levy money, which is now going to be around $108 million. It was as high as 117 when that levy was passed in 2005. And because of some of the things that are happening at the state, the change of TPP, you probably know more about that than you ever want to, the change with public utilities dollars that came through the levies, the changes in our community, the taxing and things like that, those dollars have begun to go down, and they will continue to go down. The federal side is those Medicaid dollars we can bill for, and we do bill for literally everything we humanly can bill for. What's going away, shrinking, is that tiny part of the pie, which is really other dollars and state dollars. And again, it's probably every message you've gotten, every presentation, you hear that same message, less and less state dollars, and we're seeing it. And this really tells you, well, we had 3 players before, we really are looking going forward in the next 5 years and 10 years to really 2 players going forward. So what's happened with revenues? Terry told you also that our budget has been approved by our board. At the same time, we asked that board, as you had requested, to give you an estimate. Our Ohio Revised Code, things that are relevant to DD boards, have said that we have to get an annual budget approved each year. So we've given you our best estimate of what it's going. And the importance of a 2-year budget is it gives you direction. It gives you a trend. And I think this one page gives you a good feel of where revenues are going. And if you look at that across the top, you see where we think 2011 will come in, then the budget for 12, and then any changes that are occurring, and then the estimate of 13. And what you see, the levy, you see it declining. And again, at this stage, 213 is the number where we think it'll base out at. If there is a future change in July of 2013, when the state does its next budget biennium, we will know better if the rest of the TPP dollars are going to gone, as you will know. At this stage, we think $105 million is where that levy will drop down to. Again, 117, 118 million when it was passed. Now it's down already to about 105. State subsidies is something that is declining. You see, we're looking at about 3.6 million. And again, that number holding steady. Again, the only change will be that next biennium budget, and by that time, we'll have a better idea. Divisional revenues, everything we can bill for, you see a little bit of decline there, but not significant. And other has been propped up in the last few years by the stimulus dollars. Our board was able to draw down about $30 million. By the way, every one of those dollars were tied to waiver-related activities. So the non-waiver activities were not able to draw any stimulus dollars. But about $30 million was drawn down into this community for programs and services. And so you see the grand totals, and when you go earn your eyes across it, this year we think we'll end revenues about 192, and then immediately we start taking away from that 8 million less, 184.4, and then into 213, 180, and balancing out, unless, again, we see more changes coming up in the future. So expenses. 91% of what we spend money on is people, whether we hire them and we have benefits that move with them, or we contract for services. And so we're a people business. And anytime you get smaller in a people business, it's a painful process. The one good news is that we believe that there are more than a few people who want to retire. And with pension reform in the state, that may become an opportunity for us to not fill positions and go forward in a way that we're not, quote, eliminating individuals on their jobs and things like that. But again, if we get smaller, which we must, it's going to take place in 91% in people. 9% of it is all the other stuff we do. Diesel fuel, buses, utilities, diapers, everything else that's part of our world only makes up 9% of our budget. So really it is a people business, and when you talk about getting smaller, you're really talking about trying to find ways to have other providers pick up those services, make sure that they're the absolute necessary thing that people need, or worst comes to worst, begin to reduce some of those services. And you can see that breakdown here. I think it was 48% is our own staff and benefits with them, and 43% is, again, related to group homes or some way that we are contracting services. And again, going back to that look this year, next year, and in the future, what you see here is that we proposed to our board a $200 million budget. And as we proposed that to them, we said to them, we will underspend this budget by some amount, and that amount, as Terry will tell you, is probably going to be $10 million. One of the things I didn't share, but one of the things that's a philosophy of ours that we practice and preach every day, is if you don't have to spend it, don't spend it. So often you hear in a budget, if you don't spend it, it won't be there next year for you to have, and that is not how we do business. And I'm going to show you a slide in a second to show you that in life. We really do believe if you don't need to spend it, let's not spend it. Let's wait a year. Let's wait 2 years. And that's an incredibly good thing. It's not bad management. It's not poor business. But if you look across it, you'll see that in 2013, we expect that budget to drop to $188 million. If I showed you 14, it would probably be somewhere around $184 million. And then by 15, we would be balanced budget around $180 million. Now on that sheet at the bottom, and again, we haven't shared this numbers too much, is our reserve. And if you look at it under the white line, you'll see we are at current about $122 million reserve. Didn't happen because we had a ton of levy money. It happened because we found every possible opportunity to find revenues. We sued the federal government and got about $20 million that was owed to us, owed to Cuyahoga County, in the area of what was called CAVS, day services. I told you already about the stimulus money, about $30 million, one-time monies, but guess what? Those one-time monies have been incredibly successful to help us get our roofs ready. So a lot of the capital projects that everybody has are up to snuff, up to speed, and we probably can go 5 to 7 to 10 years without worrying too much about those kind of things. So we've positioned this company with reserves because we knew that it wouldn't continue forever. And we will draw down those reserves because, in fact, they are there for that purpose. They're not there to go to a shareholder. They're not there to go to high salaries. They're there to be programs and services. And they are going to get us between 2012 and 2015, and hopefully you'll see how that will occur as Terry goes forward. Expenditures, I won't go through this much, but this just shows you all the different areas of the board. A huge part of our business is community Medicaid services, residential services, and things like that. And it is a growing area of our business. The children's services is a smaller area, and a lot of those services are occurring in public schools, in local communities, in integrated environments. Last slide for me, and then Terry will finish up. What this slide is a picture between, for the last 5 years, how did we do in terms of our budget spending? And that middle column tells you that we underspent that budget each year over the last 5, 6 years. We could have gone back farther. And one of the things that it says to us is that when we say to our board, we believe we can underspend this budget, we commit ourselves to underspending this budget, we in fact have a history behind us to substantiate that fact. So on average, we're underspending it by about 4.2%, which is about, again, on a $200 million budget, almost $8 million. So we will use this and use our current practice, and as Terry will show you some additional areas where we will cut to get smaller as an organization, and to get smaller in a way that doesn't affect the delivery of services, allows us to bill maybe private providers under the waiver, because that really is a piece there. They can bill as well as we can bill, and allow people choice to move this whole thing forward. I'm happy to take questions later, but let Terry to do these last 2 slides.
Share commitment graph. Okay. If you go to page 9, I want to show you our what we call share commitment 215. But I also wanted you to be aware that if you look at the revenue line, you'll see that our revenues have exceeded our expenses since 2005, when our levy was up. And that was by plan, the aggressive nature, and you heard a little bit about waiver when you talked about Metro Health. We were the architects of actually some of these waiver programs with the Ohio legislature. Can't remember, Mr. Brady or Mr. Miller, if you were part of House Bill 94. House Bill 94, which was the 2000 budget, allowed us to be an architect on designing some waiver programs. And those 2 waivers actually the individual option waivers and the level 1 waiver allowed us to generate a tremendous amount of revenue. Now, what it did was, rather than the state put money as the match, we have to take our local dollars, send it to the state of Ohio, and then the state of Ohio applies for the waivers from the federal government. But it had to be a 3-party transaction. Well, when I sat in a room in 2001, I asked the question not only of myself, but of the board and of my leadership team, could I see in 7 years us asking the county taxpayers for $200 million in terms of levy dollars? And the answer to that question, from my perspective at that time, and I think everybody else's perspective, was no. It's not in the cards to ask for $200 million, 7 years. But that's what was our growth rate in the 90s, was to double our levy expectations every 7 years. It just didn't make sense. So the architecture of this, Cuyahoga was an architect in terms of the waiver programs. Now, we're as large as 56 counties. When you take the aggregate number of dollars that we spend, and then the number of people that we serve, which will touch about 12,000 people this year. Franklin County and us are about the same. Franklin County's budget this year is $235 million. So my counterpart there, we always sort of kid each other about numbers, and I say, well, you know, we're doing a more effective job at $200 million. But it's the important thing here is that we built reserve, okay, since 2005. We haven't spent any of our reserve. This next year will be the first year that we spend into our reserves. We'll spend into our reserves for the next 3 years, but still maintain at the end of the time in 2015, we'll still have a 45 to 50% reserve. In other words, our reserve will be balanced, and our reserve will be somewhere in the neighborhood of $85 to $90 million. That's our commitment to you. It's our commitment to the taxpayers in Cuyahoga County. Everything we do is to try to leverage and bring back money that the taxpayers of Cuyahoga County have already sent to the federal government. So that's been our attitude over the past 10, 12 years. It's been an aggressive attitude around revenues, an aggressive attitude around protecting taxpayers here. And even though we may talk, and I remember in 2005 when we had to go on the ballot because we had a 5-year issue, was asking the commissioners at that time for a continuing issue. And we were granted a continuing issue. And part of that was to assure that there was some permanency of a base of funding. It's almost like permanent health insurance. It may not be all the money that we need, but $100 million or $108 million is a lot of money, and then we can leverage that and provide services. We're not talking about serving less people the next 3 years. We're going to serve more people. We'll just do it in slightly different ways. I just want to go back and a couple slides. Go ahead, Dave.
You're doing good.
Okay.
One more.
They don't trust me with technology.
And rightfully so.
So where we need to go, and this is called Shared Commitment 215. I wanted to bring it to everybody's attention. We share everything, staff, community, and whatever. The numbers that Dave showed you readily available to all our staff. We've always been transparent in sharing the numbers. So an organizational commitment to align expenditures with the reality of reduced revenues. Now that spike that you saw where the graph went crazy, that's all related to stimulus. And what happened was during the stimulus era, we went from having to put 40 cents on the dollar as matched. It dropped down to 28 cents a dollar. So our expenditures went down. Now, with the end of stimulus, our expenditures shot up, our revenues dropped off. Not a surprise to us. I didn't want you to think this is a surprise in any way. This is, we've been reading the tea leaves for the past 5 years and being, really optimistic about our future. Minimize the impact on services wherever possible. Emphasize a wide range of action to systematically reduce our direct delivery of services in light of the many community alternatives. As choice grows, only valued services will continue. We are unique in that we are a provider of services, a funder of services, a planner of services, and those are our statutory responsibilities, along with investigating abuse, neglect, and misappropriation. So we have 4 statutory duties, which is different than many agencies. Cut the cost of services. Cutting the cost of services by 5% would reduce total cost by $9.1 million. In all honesty, I expect that we will underspend that budget by $10 million. Evaluate all services for outcomes and cost embrace a practice of, and I don't know if this is the right term, we're the safety net, the agency of last resort for future undertakings. But we have great providers in the community, and some of you have met some of them: United Cerebral Palsy, Achievement Center for Children, JFSA, Koinonia. We deal with many, many providers, and our money flows to them. So they will take on more of the provider role of the board. How much? 10%, 15%. We're not going to, dramatically get out of the provider service, but we're going to shift it by somewhere in the neighborhood to 10 to 20% over the next 3 years, with the understanding that there's quality services that we're paying for. That's always the understanding. Prepare the organization for a levy in 216 or beyond. And I say that very, very much. I'm not sure, whether or not there'll be another levy in the future. That depends on many, many factors. Today, I understand where you're at. I understand and heard it and understand it. And who knows where we are 4 years from now or 5 years from now, or the next time we may need dollars. But what I will tell you is that we'll be balanced going forward. We'll spend a little bit of the reserve, but we'll never be out of whack relative to revenues to expenditures. Continue to grow this public-private partnership into a national model of care with emphasis on community inclusion, choice, healthy competition, and service leadership. Accept nothing less than the combined best. We've been doing public-private partnerships for many years. They're good things. It stretches government dollars. We're going to continue to do those things. We just monitor the issue for quality. How do we get there? Trimming of staff costs. We've been down about 100 employees over the last 5 years. I expect over the next 3 years, we'll be down another 100 employees. It may be a few more. Absorb natural attrition of staff retirements. Staff-wise, we're an aging organization. As an organization, we're 45 years old. I've been with the organization for 35 years. I have many colleagues that have been there 28, 27, 30, and whatever. So we have a natural process of people leaving. For the last 2 years, we've basically had a hiring freeze with the exceptions that the superintendent would make. So I look at every position that comes up as to whether or not we're going to replace it or not. Consider hiring freezes, reducing the number of part-time staff, layoffs. Unfortunately, layoffs will be part of our future over the next couple of years. Control wages, which we have at 2% or less. We've had the fortune of being able to give raises because of our fund balance and things. So we've been in a positive situation there. And our staff have really worked hard to generate revenues. Almost every one of my staff people is a revenue generator. I bill for some of my time to the federal government because of our waiver activity. Almost every one of our staff in a provider role draws down some revenue. Defer capital projects to emergencies only. The stimulus has helped us immensely. We have 16, 17 facilities. We're roofed. We're in good shape. Some of you have recently visited our facilities. I think you'll find that our facilities are among the best. Our group homes, you own 58 of our homes. The county does. And we have another 300 homes that we work with North Coast Community Homes on developing over the years. We'll just shrink our home repairs somewhere in the neighborhood of 50 to 70%, while 25% reduction in terms of cost, and we can handle that. Limit waivers to replacement and super emergencies. The average cost of a person on a waiver who's living in a home is approximately $45,000. The board, we pay 40% of that. The federal government pays 60% of that. Now, in the last 5 years, we've added 2,000 people almost to waivers. It's been a tremendous growth period in the history of the board. That's been good. It's been good because it's given people places to live. It's supported consumers who are living at home with their families, and that we can send people in to help elderly parents. Those things are all possible because of this. Transition center-based school-age program to school districts in the ESC. We used to have 5 schools with 1,000 kids. Over the last 20 years, school districts have taken that on. but we provide technological support to all the school districts. So I've got staff who go out and work with school districts on kids with behaviors, curriculum, assistive technology, rehab engineering. Reduce our adult enrollment in our centers. We're going to shrink that by about 300 people. We're not going to push people out, but through natural attrition and also through some private providers who want to take on more of day services, we'll do that. In-house transportation. We're the third largest transportation company in the county after RTA and the Cleveland Public Schools. But we've got 15 partners, cab companies, airport, limo. That makes us very diversified and allows us, rather than send a school bus to pick somebody up at 3 o'clock to go to a job, we can send a cab. But each one of those transportation providers has been trained and is certified just like our drivers, and there's daily checks in their backgrounds and so forth and so forth. Family resources budgets are dollars that we give to families, anywhere up to $1,500 that they can use for respite care and other things. We'll look at that. I think we'll be able to maintain those types of resources. We have 294 licenses for those 58 homes. We hold the licenses for those people, and that's a different funding source. It's a long-term care funding source called ICFMR. Mr. Greenspan recently visited, Mrs. Conwell, Mr. Rogers, and many of you have been at our group homes and have seen Mr. Germani, I know, and others. When you get to an ICFMR, Mr. Greenspan, like we were, the average cost there is probably close to $80,000 a person. It's like a smaller nursing home, but that's paid by the state and the federal government. It's not paid by the county. We may add a few dollars to it, and we do maintain that home. So it's another, we may allow some of those 294 to go to day services with the private providers, which would, again, lessen our day roll cost. Evaluate service models and early intervention. And I know, Mr. Brady, you had an interest in terms of our work with autism and things like that early on. We do a great deal with autism. We're the largest early intervention provider in the county. We work hand in hand with Help Me Grow, but we'll probably realign ourselves to what's known as the state model and service coordination. It's called Service Coordination +2. So a family can pick a home development specialist or a physical therapist or a speech therapist to work with, and that'll change us. Consider waiting lists, and in all honesty, I'm not going to put people on waiting lists with a carryover budget like we do have, or carryover reserve. The only place we have a waiting list for services in it is in the area of residential, where I have 2,000 people looking for residential supports. That's not today, though, necessarily. We've been able to handle whatever the demand is on a yearly basis, and we'll continue to do that. So that's our plan going forward. I'm very confident that we will continue to be very, very successful due to this community support. I've said before, this community has supported us, with a vote of the people at about almost at 75% over our 45-year history. Our reputation is solid. We are a national model. We just went through accreditation. I expect a 5-year commendation, and we're nationally accredited by CARF. You can be very, very proud of what we do here in Cuyahoga County when it comes to people with developmental disabilities. Let me also say that we work very collegial with all our other county agencies. About $6 million of our budget is actually funneled to other entities within the county. So whether it be Mr. Denahan, Metro Health, Children's Services, the courts, we're spending about $6 million by helping. But again, we have limits in terms of we have to serve eligible people, but they serve some of the people that are eligible for our services. So about $6 million of dollars flow from our budget into the other county budgets. So thank you very much. I'd be glad to take any questions, or Mr. Wysocki or Mrs. Petty.
Mr. Ryan, as you know, we've been here for about 4 hours. And as you also know, because you were with us at an earlier meeting this morning, we've been at this for quite a while. the contrast, of course, between the Adams Board and their straits and the situation that you've just presented is couldn't be more night and day. It's a little confusing in some ways. We know how important the work you do is. We got that part of it. Since you're flush, and since there are so many other asks, I'm probably not going to spend a lot of time asking you questions, except that I certainly want to have you back before the committee to learn more about the mysteries of how you've accomplished what you do. But could you, the one question I do have, wondering how you get to a $100 million reserve, is I know you have your own levy.
Yes.
And could you briefly give us the history
Of our levies?
of that levy and how you got to this point? You have a continuing levy at this
Yes.
point, correct?
Yes.
Could you give us just a little bit of, because we're comparing this to the other
Sure.
difficulties that we have versus what doesn't seems to be that you seem to be very self-sufficient.
Sure.
And so we're,
Well, let me say, we didn't have a $100+ million reserve in 2005. We had a reserve that was probably 25% at that time of budget, which is what the county would always want you to maintain, is somewhere between 20 and 30%. That's where we were. Our history starts back in 1979 when we passed our first issue. And then every 5 years, there was one 6-year levy in there. It was changed, and the millage was changed gradually over the years. But that 3.9 has been in effect for almost 15 years. And again, when I went to the commissioners in 2005, the issue that I was trying to attain, and not that we hadn't tried to attain it before, but continuing is important for us because the people we serve, it's long-term care. It's not, these are conditions that are not going to change. These are the most vulnerable of the vulnerable. If something would happen to our levy, and I hate to bring us back to 2010 and what was going on there, but anything that had county on it, and we would have been on the ballot in 2010, may have had difficulty in passing. The issue that spurred examination of this in 2005 was the Defense Department was going to lose 1,000 jobs. And I made the comparison that if our levy failed, not only would 12,000 people and 50 different agencies basically not be able to serve people, thousands of employees would be affected. And what I really said at that time was, give us the opportunity to have a continuing issue. I'll take our 5-year issue, which was our normal 5-year replacement, Chairman Brady, and I'll stretch it out to 10 years. We made a bold assumption, okay, that we could do it. But we did have a degree of confidence in that we knew this level 1 waiver that was there, we could refinance our entire adult services. So we were very, very aggressive relative to doing that. And I have a number of staff in our fiscal office here called Revenue Hawks. We passed on no opportunity to go after revenue. Other counties did. We did not. And in all honesty, we had a home run on them all. And then Mr. Wysocki talked about suing the federal government. Actually, we sued the state of Ohio. We were the lead county in an 88-county class action suit to basically get the state to give us the money that they owed. So $22 or $23 million was then garnered because of us, Cuyahoga County, taking the lead. Now, I didn't want to sue the state. I didn't want to be the lead, but we are looked as the leader in the state of Ohio. So more than $100 million was returned to counties across the state of Ohio. So that $20 million, and as you know, any court action can be trended out for a number of years, we prevailed in the court action, and the state paid us, and they paid every other county. So $20 million of that fund balance, actually a little bit more, probably 22 or 23, is another additional source of revenue going forward. And then we tried to manage our growth at about 2%. We said, let's manage our growth at 2 to 3%, find ways to serve people, do it well. And we've always had the attitude, or I should say since 2000, we've had the attitude is, don't spend every last dollar that you have. Spend the dollars that are needed. But the waivers, and I think when Mr. Corlett, actually he was in Columbus for part of the time, that'd be a great thing if Metro can get it. The caution is it takes time sometimes to get those through the federal government. So that's how we've built it. And we've never been in a position where we didn't have to tap into it earlier. So actually in this most difficult of time, we've had the opportunity to generate revenues. And then the federal stimulus did add $31 million, which allowed us not to have to cut into our levy balance. So in this most difficult era probably that we've seen in the last 40 years, we are the most financially strong than we've ever been. So
It's nice to know that we have one problem we don't have to figure out here in the next couple of weeks. But any other questions by the committee?
Well, let me just say, we do try to work creatively with all our county agencies.
I did hear that part.
In a
I
very
listened
creative,
very carefully to that
in a
part.
very creative manner. And,
Okay.
But again, I do have certain legal liabilities that I have to be cautious about.
Right, we just can't take your money, right?
Right.
So how much money do you want?
We don't want any, sir.
No, just kidding.
Thank you. And I do want to, and council already in your early nature has been very helpful to us. Mr. Greenspan has opened up some doors in terms of our farming initiative and the weatherization program. And Mr. Bender's has been over looking at economic development. Mr. Gallagher's been out. You have been responsive to us in terms of looking at new and creative ideas. We will take some risk. I want leaders who can give us generate ideas. We're going to hit on 9 or 10 of those. We just don't want to make a fatal, I won't say a fatal, a bad decision. So, we have very, very smart people. We have a board who is outstanding, who 4 of them happen to be family members. By law, 3 of them need to be family members. You'll have the opportunity at the end of 2012 to appoint 2 members because 2 of our members will have fulfilled their 12-year commitment. They're 4-year terms, but they can be upped on for 3 terms. We've had a history of outstanding boardsmanship, people focused on the mission of the agency. And we never forget, the thing that we never forget, I myself have a brother with a developmental disability. Not that that makes a difference, but our staff don't forget about why we're there. We're there to serve people. And as I said, that video is worth all my words today, is to play that video or to have you come out and visit or spend some time at any of our facilities, whether it's ours or in the community. And we're blessed to be in the situation that we are. And we will not be going back to the taxpayers for a long, long time. And the circumstances, I know the circumstance you're dealing with. We're concerned about property devaluation and all that. I knew, when I was here a few weeks ago and I heard the executive talk about a flat levy, I know why he can't replace it, because you're not going to get any more money. And I know it's not the time to ask for new taxes. So those are also measures that made me harden our stance relative to going forward a little bit more. Take nothing for granted. There is no expectation that we have in the near future to go back to ask taxpayers for more money. We're going to do our due diligence and continue to work hard to balance things out and serve people. And we will continue to serve more people. Thank you.
Thank you very much. Councilman Miller.
Mr. Chairman, Director, when you put the 2005 continuing levy on the ballot, how did the percentage support compare with earlier levies which are not continuing?
We were like 70.1%, which is right up there, right around where we were. So our average is somewhere between like 72%. In one presidential year, I think we dropped to about 60%. But we were at like 70.9% in that year for continuing. And it was a replacement.
And Director Ryan, during that campaign, was much opposition expressed around the idea that it was continuing rather than for 5 years?
No, it wasn't. No. Okay. Now, the other thing about us, we can't use levy dollars for our levy campaigns. We'll spend, or we did spend in 2005, almost $500,000 of funds that have been raised over the years. We have a couple of events each year. We have a little golf outing. We have something else. We raise money. We raise money. We raise money. By the time, and in fact, I think we've probably raised almost $400,000. So the next time, if there is a next time, we'll have the dollars to go for a levy, and we would not be asking for any type of dollars from some folks. So we raise our money for our own levy campaigns. We do it very scientifically, and but the continuing, to your question, the continuing was not a negative at all. We use Mr. Dykes and Dykes to poll, and we've used Mr. Burgess to help us with campaigns for many years, and then our staff and our families. And again, our message is fairly compelling, and we pass in every community by a high margin. So it's not like we fail here and we pass there. We pass in every community across the county.
Well, it's a tribute to the citizens that they recognize the need and so overwhelmingly support it.
Mr. Chairman, that's true, and I tell that to people across the nation about the compassion of the citizens in Cuyahoga County.
Any other questions by the committee?
Chair.
Councilman Jones, then Councilwoman Conwell.
Thank you, Mr. Chairman. And Director Allen, I wanted to know, do you have any partnerships or fund the vocational guidance services?
Yes.
You do?
They're one of our biggest partners.
Are they?
Vocational Guidance Services, Mr. Comden. For close to more than 25 years, we've been working with these vocational guidance services. I think just about anybody you name in the community, we partner with.
Okay.
But they're one of our largest partners, in all honesty. They are our largest partner.
They are your largest?
Yes.
Okay. Funding-wise, Mr. Chairman, what type of dollars are we talking?
Probably close to $15 million.
A year?
Right. And we recently were able to partner with them because we're a public entity. They were able to flow some dollars through us along with the society, or the Cleveland Site Center. We became the fiscal agent and then took our monies also and went to RSC and brought $2 million worth of funding into our county. And that's going on, that has been going on each year, $2 million of additional funding. We didn't have to be the fiscal partner, but we thought it made sense to bring dollars into Cuyahoga County. So that's the type of partnership we have with Bob and others, Bob Condon and others.
Thank you.
Sure.
Thank you, Councilwoman Conwell.
A couple of questions through the chair to the director. So I just want to get it straight. So the money you don't spend from each levy, you kind of put in reserves?
Oh, yes, yes. And actually, you hold the money. And in all honesty, that helps your bond rating also. And we receive no interest off that money. And you also take $3 million off the top for government, which is understandable, the work that you do, collecting taxes and those types of things.
Director, you testified 300 people, there's 300 people you're going to move through attrition?
No, it'll be through a process of, in terms of our adult centers, which there's 8 of them. There's about 250 in each center.
These are adults?
These are adults. Over the next three years, I think over the next 2 or 3 years, through attrition and through just giving people more choice to go to private agencies, that our numbers that we serve directly, there's a little bit of a cost. We have a higher cost than a private provider does. As you know, Mrs. Conwell, having been in the business for a while, so that lessens our cost. But as long as the quality of service is good, we would support that.
Okay, so I'm just concerned about that.
It's
Okay,
not
so
a net loss in terms of the number of people that we serve, because our dollars will support them.
Now, these are day programs, correct?
Yes.
So would you say that they really have a choice that they can stay or?
Yes, absolutely.
And
We
do you-
honor choice of provider. We're a provider. We can't force somebody to stay with us. So when somebody's on a waiver, they have free choice of provider. So if they want to go to VGS, or if they want to go to Koinonia, or if they want to go to JFSA, they can go. We'll pay the match on the waiver for the day cost.
But I'm kind of getting that you want to move through about 250.
Well, it makes some sense economically if there's a capacity in the community to do it, and they could do it at 25% less cost. Does that make sense?
Yes.
Okay.
Any other questions?
Can I just get one just thing, since you asked before, ways to help? There's something about having it's your own company, if you can appreciate that. So you have to find solutions within your resources. Yes, we can go back for a letter, and ask for your help and support, but we know how hard that is. But there's something that is integral to, and I don't know how you would do this in other, county kind of organizations. But when you know those dollars, and you know that to make it work, you have to cut costs, and you have to find solutions that don't hurt the people you serve. There's something about that model that seems to work very well for county boards. I just want to share that with you. I don't know if it's a kernel of an idea, but I think it is something.
I don't know if how close the analogies might be, but I think, I understand your point, and it's well taken. We know that we are faced with a challenge, not just with the Adams Board, but with Health and Human Services in general, and in other areas, and we need to do some long-range planning, and be able to do what needs to be done over a reasonable period of time. And so your point's well taken that way, and congratulations for your own success.
Thank you. Thank you very much for the time today. We really appreciate working with you, and it's a little different in terms of the
Yeah, you probably haven't had this much public exposure in quite a while. Huh?
No, but you're always welcome to attend any of our meetings. It's the fourth Thursday of the month at our central office at 1275 Lakeside, and those are all posted and whatever. So.
All right, thank you very much.
Thank you.
Appreciate it.
Well, we are
Not quite done, but that's one of the good reasons to have budget hearings every 2 years instead of every 1 year. We have the Cuyahoga County District Board of Health, and Terrence Allen. And Terrence must have been Terry. Okay,
Chairman,
Terry.
thank you.
Must have been extremely patient. We promise you we won't delay you.
I promise not to delay you either, Mr. Chairman. Thank you very much, Mr. Chairman, members of council, for the opportunity to present. I will briefly provide you an overview. First, I wanted to introduce our Chief Fiscal Officer, Judy Wershing, who's here with me to support me today. You have in the packets that we provided the slide set that I'll go through, and again, I'll be brief in the slides, so the materials are there. A list of a narrative on funds that are received by the Board of Health from the county, and also a narrative on funds that the Board of Health sends to the county for various purposes. Along with that is also an overview of programs and services for your review. So Health Department started in 1919, back after the Spanish flu pandemic in Ohio and in many other places, and we're authorized under 3709 in Ohio Revised Code. And we're an arm of the Ohio Department of Health, actually an arm of the state health director, and I know the members that have worked in the legislature are aware of how boards of health operate. Our board is appointed, a Board of Health is appointed by a district advisory council that's is comprised of the village and township mayors and trustees and the office of the county executive under Ohio Revised Code 370903. That district advisory council appoints 4 members. Also, there's a district licensing council that at the time Speaker Householder established that required boards of health to establish a board of their, a council of their licensed entities, the regulated community. And from that regulated community, 370941 requires us to appoint a member to the board. We serve about 860,000 people in 57 communities. There are 3 health departments in Cuyahoga County, the City of Cleveland, the City of Shaker Heights, and Cuyahoga County Board of Health. Back in the 90s, there were actually 6 health departments, City of East Cleveland, the City of Cleveland Heights, and most recently we contracted for services with the City of Lakewood. 36 city contracts and the 19 villages and townships are part of our general health district. We have about 200 employees. This past year, we laid off about 35 people in our school health program. We've been competing with private industry over the past few years, and we've been having to subsidize those contracts. It made sense in our strategic planning process to divest of some of our large school health contracts and allow private industry to do it cheaper. We're happy that a number of those folks actually took positions in private industry, but unfortunately a number of folks lost their jobs. Our budget is $21.8 million in 2012, and in 2011 it was about $23 million. It's about a 6% decrease. The decrease is related to school health, related to some ERA funding, about $2 million in ERA funding that we received, and some cuts in emergency preparedness funds that we get through the state that is federal. That's been reducing, and we've been planning for that as well. Our organizational chart you'll see here, the District Advisory Council and the Licensing Council I mentioned. Our Board of Health, I am appointed by the Board of Health. We have a medical director, and our main arms are in prevention and wellness, environmental public health, epidemiology, surveillance, and informatics, and administration as legal, fiscal, and organizational development, which is performance management and human resources. All those, the programs are described in detail in the materials that I provided to you, so I won't dwell on those details. I want to give you a sense that we do work beyond Cuyahoga County. We actually have a number of activities that are regional, that we've been picking up. What we're seeing is a trend at the state level, that the funds are being consolidated, they're being let out in competitive grants, and it's requiring us to pick up more territory for those that would respond to the RFPs. For instance, we serve 14 counties, and our dental options grant provides either free or low-cost dental care for those that don't have insurance. We case manage those activities and work with dentists who are willing to provide care either free at low cost. We handle the Ohio Child Care Resource and Referral program in 8 counties, and that helps nurses working with child care workers in terms of health and safety guidance and education. We have a 7-county breast and cervical cancer screening grant for people who are uninsured. We provide them at Medicaid rates. We have a whole range of providers in the community that are willing to provide screenings, and then also we have dollars available for treatment for those. We serve about 3,000 women with that program. We coordinated public health emergency preparedness in 5 counties, dealing with things like H1N1, preparedness for a pandemic flu. We dealt with the smallpox business a few years ago. We work very closely with emergency management and justice affairs and emergency response, volunteer coordination. We also recently picked up the personal responsibility education program, working with adjudicated youth in 5 counties around pregnancy prevention and education around responsible sexual behavior. We deal with illicit discharges related to stormwater, helping communities comply with Phase 2 requirements of EPA in 46 communities in 4 counties. We do stream restoration work as part of our watershed management program with some ERA funds that we've received in 3 counties. We enforce the Smoke-Free Workplaces Act, 2,400 complaints investigated, 300 this year. Great success that I'll talk about a little bit later in that program. One of the most important public health initiatives, policy initiatives that ever occurred in the state was the smoke-free law. Bathing beach samples we do in 2 counties, and we do multi-jurisdictional outbreak investigations on a regular basis. Our budget, is, as I mentioned, about $21.8 million. $3.2 million of that are city contracts. We contract with the 36 cities at $384 per capita. That rate is about a third of the rates in Columbus, Summit, and in Dayton, Montgomery, which are around $10 or $11, $12 per capita. It's because you can look here and see that a large percentage of grants, about over 50% grants we receive, so we're constantly shaking the bushes looking for new opportunities for funding. License permits and fees at $3.2 million, and charges for services at $1.6 million. If you look at the 54% of those funds that we receive, 76% are federal dollars, 10% state, which is continuing to diminish, and 14% are local funds. In terms of expenditures, 41% for staffing and fringe, services and charges at 5% of the budget, grants to subcontractors for services. We have a range of agencies, nonprofits that we work with to help provide services in the community, supplies and materials at 2%, and capital outlays at less than 1%. The next is a list of dollars that we receive from Cuyahoga County, and next to it are the list of the funding source, the different departments of the county. I've worked for 23 years in public health and cut my teeth through just about every program in the community, and I just wanted to say while we're here that I've worked with some of the finest people I've ever known here at Cuyahoga County, at our department, and also at the departments that you see here, and the people in this room that support that work from Health and Human Services in these departments. It's been a pleasure to work with them, and they truly care about what's happening in the community, and it's been my distinct pleasure to work with all of them. But here's a range of programs and the dollars that we receive. The new one on here that is for 2012 would be Ryan White, and we're in the process of working with the administration relative to Ryan White, which is a $4 million application to the federal government. Previous to that, if you remove it, our funding has been between $2 and $3 million, fairly stable over the last 3 or 4 years in terms of funding from the county. The next slide shows dollars that we remit back to the county. The first is for construction and demolition debris disposal. So dollars come for tipping fees per ton for waste that's deposited in county. We remit dollars back to the county and to the host communities for that work. We fix a lot of homes. Cuyahoga County has the dubious honor of being one of the 5 highest communities in terms of lead in the country. And so we fix a lot of homes to deal with lead hazard reduction, particularly in our first string communities and in Cleveland. And also we have a Healthy Homes initiative that deals with triggers for asthma, moisture problems, and the like in homes, working with the Department of Development. We have a whole range of funders. We aren't the size of Terry Ryan's operation, but we've got a lot of people that know how to shake the bushes and look to diversify our funding sources. And so that's a commitment that we make to look for opportunities to do that. We too are looking at Medicaid billing and increasing our Medicaid billing opportunities for work that we do to enroll folks on Medicaid, and also to work with the Center for Medicare Innovations on looking for ways to work with medical providers to actually try and reduce asthma exacerbations by keeping people out of the hospital in the first place, or reducing ED admissions, or helping to reduce low birth weight babies that are readmitted, working with Invest in Children. These are all ways that we think we can reduce costs and also look for opportunities for funding. Some outcomes, just a sample of outcomes. Lead poisoning rates have dropped by 46% between 2004 and 2009 from our work. Lead poisoning has everything to do with workforce development. It has to do with IQ. It has to do with cognition and retention, and kids' ability to reach their full potentials, particularly at low-income children. Our smoking rates have dropped by 11% between 2002 and 2008, a big drop, which is important. 98% compliance on the Smoke-Free Workplaces Act in over 5,000 locations, and we, in multiple counties, have been enforcing this because some health departments have turned back their responsibility. We want to see the act held up. And there's been a 26% reduction in emergency department chief complaints for heart attacks. Big savings down the road, big savings to the system. And no significant impact, despite those that have said otherwise, on restaurants and bars because of this. We did 41,000 vaccinations for H1N1 in just a couple, 2.5 months in 2010, using a volunteer network that we developed and working with our cities and our fire chiefs and a range of volunteers. 3,000 women screened for breast and cervical cancer prevention in funding year 2011. And rabies has been knocking on the door in Cuyahoga County for some time, and so we actually hand throw out these fish meal baits that have a vaccine that vaccinates raccoons, working with USDA against rabies. So we have staff that go out and go along tree lines and along dumpsters in the back of strip malls, and we've been able to keep rabies from moving, raccoon strain rabies from moving into Cuyahoga County, because then our pets tangle with raccoons. Could move rabies into our households, affecting our families, and rabies is 100% fatal if not treated. So the last is we investigate 2,000 communicable diseases every year, and 30 outbreaks that we respond to on an annual basis, from foodborne to waterborne to a range of other outbreaks that we investigate. HIP Cuyahoga is a program that involves 40 community agencies, Health Improvement Partnership Cuyahoga, working closely with Case Western, the health departments in the county, and these partners. You've actually helped us, and we appreciate it, Council, in putting on your website the link to our survey. We have a quality of life survey that we've deployed throughout the county to try to hear from residents in terms of for our community engagement portion of this process. We're actually assessing a range of indicators around diabetes, heart disease, cancer, asthma, indicators that we have data on to look at rates of illness. And we're matching that up with what the people in the communities think are the highest priorities. We have 6,500 surveys we received back to date, and we're going to make sure that it represents the demographics of the community in that work. The idea then is to merge the objective data we have on all these health indicators with what the community feels are priorities around quality of life, and put together a multi-year improvement plan working with 40 public health agencies in the community. And many people in Cuyahoga County working for under the county executive and for the work of council have supported this work. We also have a multi-year quality improvement plan. There are national public health performance standards from CDC, a national public health accreditation, as Terry Ryan mentioned, that just opened up this year for public health for state and local health departments. We'll be applying next year for national public health accreditation. There are state improvement standards. We have a range of performance goals, quality improvement projects around increasing our nurse to client ratios, around home visiting, around decreasing the number of critical violations in restaurants relative to temperature control and cross-contamination. Also increasing our provider reporting of communicable diseases. And we have individual management objectives for each staff person that they're monitored on annually, and we roll those up across the agency to report to our Board of Health. In terms of challenges, the program shifts related to national health reform are affecting us. We're hoping that more money will go into prevention. 95% of healthcare dollars are spent on treating disease. 75 cents out of every dollar is spent on chronic disease, like obesity, related to asthma, related to diabetes, related to cancers. And so there will be funds in the in health reform and the Prevention and Public Health Fund that will allow us to implement prevention programs to show that public health can have an impact on outcomes and save money to the system. Policy decisions like the Smoke-Free Workplaces Act have a big impact and save money, and so we believe policy decisions are our future, and the way to catalyze that will be through national health reform. We're facing funding challenges. We have about a $5 million reserve for capital expenditures for dealing with grants that cross calendar years for dealing with emergency-related issues, but we're going to be diving into that in 2012 to the tune of $600,000. But we're trying to begin to control costs as we move forward in the next few years to reduce those risks. But basically, in terms of that balance, most of it is spoken for relative to trying to depreciate our roof, depreciate our building-related costs, our ventilation systems, internal maintenance issues. The widening gap on health inequities is probably the biggest challenge here with the issue of suburban poverty that we've been reading about. There is actually a 25-year difference in life expectancy between inner city communities and outer suburbs in a couple places in this county, which is unbelievable. And that gap is something that we really need to begin to address, and people think it's relative to education. It's tied back to just related to jobs. But we think that there are fundamental issues that exist in communities through very dedicated planning. We can begin to reduce some of these equities by looking at the resources that are available in communities in a different way. And we are also looking to support national accreditation for local public health, as I've mentioned. But with that, I'll stop, and I hope that was brief enough for you, given the time. Thanks for listening.
Thank you for that succinct, substantive, and very well articulated presentation. Questions by the committee? Councilman Miller.
Mr. Chairman, Director, do you have any sense of how the 46% reduction in lead poisoning rates was achieved? It appears to be quite remarkable.
Right. Actually, we have, since 2004, with the help of the St. Luke's Foundation, established a lead advisory council in Cuyahoga County that is comprised of 75 agencies. And that involves academic, public health, not-for-profits, businesses. And what we've done is combined our work around funding from HUD to do lead hazard control in homes. There have been homes that have been demolished also that are no longer poisoning kids. We've been educating moms in the community and families about risks relative to lead poisoning. We also have been educating people about how to properly clean homes to reduce risk. Lead isn't about paint chips, it's about dust. It's about the dust when you open and close your windows, it's friction points, it's doors, it's front porches, it's soil around the exterior of homes where kids are getting poisoned. And it doesn't take much to poison a kid, but we know that just a small amount of lead can have a big impact on IQ. And then you're then treating sort of downstream those illnesses related to lead and the compounding disadvantages that these kids in inner cities are facing in the first place. But we think that 75 agency strong consortium of people that focused on lead and every aspect of lead, along with the work funding we receive from HUD, has been integral to our success.
Mr. Chairman.
Councilman Miller.
Have you seen any uptick in the smoking rates since the state has pretty much shut down the tobacco prevention program, or has that not occurred?
Chairman, Councilman Miller, yes, we are, and this is unfortunate. It's what we're seeing is, as you know, all the funds that were in the Tobacco Prevention Foundation, as you are fully aware, were securitized and are no longer available, no funds for tobacco reduction. My biggest concern is that the quit line, which is probably the most cost-effective public health intervention for smoking, is on the rocks. The quit line has a 34% quit rate. It's a 24/7 line that supports people with nicotine replacement therapy, and that quit line costs about $200 for a year of treatment and will reduce rates by 34%. So yes, our concern is rates are going back up even with the smoke-free law. And so that's a big concern, and we are urging the state to continue to support the quit line at a minimum with general revenue funds, because it's a very cost-effective public health intervention that saves, 100 times those dollars in treatment downstream.
Well, thank you very much.
Welcome. Thank you.
Any other questions from the committee? Really? I'm going to gratefully turn the gavel back over to the chairman of the Finance Committee. Thank you. Appreciate your presentation.
I would like to thank Councilman Brady for running the meeting this afternoon. Our next meeting of this committee will be the day after tomorrow, on Wednesday at 2 o'clock, when we will hear the presentations about the suggestions regarding the budget and start the process of amending the budget. We have now completed the process of hearing from the agencies and departments. We've completed a significant milestone in the budget process, and I would ask my colleagues as to whether there is any miscellaneous business. Hearing none, Madam Clerk, has anybody signed in for public comment to close the meeting?
Yes, Mr. Chairman, there are several persons who wish to address council. The first is Charles C.
Mr. C., welcome to the committee. Presenters have 3 minutes, and when ready, you may proceed.
Thank you very much, Mr. Chairman, members of council. It was probably this time in the evening after a long day like this that the phrase was coined, brevity is the soul of wit. So I plan to make my remarks quite brief. Thank you very much. I'm here in 2 capacities. 1, as a service provider of reentry services, and 2, as a grateful citizen of Cuyahoga County. I'll address my first capacity first. As a service provider, I'm here to encourage the favorable consideration of Bill Dennehan's request for increased funding for reentry services. You heard Bill talk about what funded reentry programs for disabled persons can do. He talked about recidivism rates going from 65 to 40%, 50% to 4%, 65 to 25%. Funded programs of this nature make a significant difference in our community, particularly among this population of folks, which represent the most vulnerable. These are the folks that we have sleeping in homeless shelters. These are the folks on street, sleeping on grace in the street. These are the folks that no one comes to see anything about. They are truly the hurting, forgotten, and oppressed of this population. I want to favorably encourage, I want to ask you to favorably consider Bill Dennehan's request for increased funding. Every time someone goes back, this population, we have a high recidivism rate. Every time someone goes back, we spend an additional $25,000 to $30,000 in state prisons. If we can keep those folks from going back 65% down to 4, 50% down to 4, that's money that could be made available to come back here to Cuyahoga County, where we can provide other services to some of the other programs that you heard talked about here today. As a citizen, I'm here. As a grateful citizen, I'm here to thank you. I've sit here for 4 hours a day, and I've seen how you have diligently, with heartfelt compassion, struggled with these issues that have come before you. We realize as citizens that this is no easy task to provide, to allocate limited resources to this community, and we appreciate and we thank you for the struggle that you've done, for the honesty of the inquiry that you'll make in providing these services, and for the dignity with which you conduct your business. Thank you again. I want to strongly encourage favorable consideration for Bill Dennehan's request to increase services to the reentry population, particularly those with mental disabilities. Thank you so much, Mr. Chairman. I appreciate the opportunity to appear. You folks get you some dinner this evening, I certainly hope. Thank you so much.
Thank you for your testimony. Madam Clerk.
The next citizen requesting to address council is Ms. Molly Brudnick.
Thank you very much for your patience and hanging with us. And Ms. Brudnick, we welcome you to the committee, and you may begin.
Thank you, Mr. Chairman and Council. My name is Molly Brudnick. I come to you as a representative of the Ohio National Association of Social Workers. Our organization's premise is that, and I quote, "A just society not only ensures that basic human needs are met, but also invests in the social well-being of its members, especially those who are unable to provide for themselves," end of quote. We therefore ask that you increase the millage rate of the Health and Human Services levy that you place on the 2012 ballot. This is necessary to help meet the ever-increasing needs for social services due to the growing number of unemployed persons and people working whose wages are so low that they live in poverty. Property reassessment in 2013 is expected to reduce the taxes collected by 5%, and because they account for 27.2% of all funds in 2012-13. We will further reduce funding for human services due to state cuts in funding to assist local governments in aiding the needy, as well as loss in revenues from the commercial activity tax. Cuyahoga County will lose $71 million in revenue during 2012-13, having additional impact on the Health and Human Services budget, which is 45% of the total proposed county operating budget. In the best interest of the neediest of our citizens, an increase in the Health and Human Services levy must be introduced in 2012 and supported by County Council and all caring citizens to bring staffing levels in Health and Human Services to the level of suggested best practices. Thank you.
Thank you very much for your testimony. Madam Clerk.
And the last speaker is Mr. Rico Dancy.
The last name again, please?
Dancy.
Dancy, okay. Mr. Dancy?
How are you?
Last but not least, we appreciate your patience and welcome to the committee.
Okay, I've been in Columbus for the last 2 weeks fighting. I've been in Columbus for the last 2 weeks fighting for Ohio Rehab Service Commission. The governor cut the funders told me he's trying to close one of the buildings. They have 2 buildings, one on Detroit and one in Euclid. When they close the one in Euclid, it's just going to be one building for all the community people who receive service, for the council who deal with people who are disability, deaf, blind. They deal with all people. Once they close that building, we're going to be down to one building. I've been in Columbus for the last 2 weeks trying to fight it by myself, trying to save the building. I'm here to see, can y'all write the letter to governor, whoever, contact to see can we save the building. They're trying to close it no later than December 10th. That's what I was told. I've been going every week fighting for the last 2 weeks. Thank you.
Thank you very much. Madam Clerk?
No one else has signed in to speak.
Okay. Do we have a motion to adjourn? Moved and seconded to adjourn. All in favor, say aye. Aye. Any opposed? We are adjourned. We'll see you the day after tomorrow.